Loud.
Okay, so this meeting is being recorded. This is the December 15th meeting of the Shutesbury Board of Health, and we're meeting obviously by Zoom. And there we have it. And can we quickly approve the minutes of the previous meeting? Were they okay? Any
Yes.
problems?
Yes.
Problems.
Okay. Oh, this guy, well, let's do this. This guy who lives at 542 West Pelham Road, which is the house that Mary Mann used to live in, Arlene. And has put up a studio in the backyard. He is applying for an upgrade to basically just add a septic tank and a connection from the studio into the system, that 5-bedroom system that we had the perk party over at Mary's when she put it in. Remember that?
Right.
And
I'm repressing that memory.
right.
Okay.
I only just got the application and I gave it to Charlie today at another meeting. So he hasn't approved it yet. But why don't we, if it's all right with you, vote to approve this when we get everything in order? That's Charlie's agreement and a fee. Does anybody object to that?
Moved contingent on his approval.
That was a
Second.
motion. Thank you. All in favor?
Aye.
Aye.
Yes.
Aye.
Okay. All right. So riddle me this. We charge $50 for a single component. Would we consider a septic tank and a connection to it to be a single component?
Because you're talking, the leach field already exists. He's just
Right.
putting another tank in.
A second tank, yeah.
Yeah. I would
Okay.
think that's one.
I would too.
Okay. Okay.
I would also.
All right. Right. Okay. So I'll get in touch with the owner and tell him to send us a check for $50, and then as soon as Charlie's done with the plan, we'll go. I can't imagine there would be anything to review, really. Well, let's do the stuff on the list, and then I'll tell you about the district meeting that I went to today, and we can do any other updates that we have to do. So, so let's get this open meeting law thing out of the way. And just to sum up, we had an open meeting law complaint alleging that we had violated the open meeting law through emails or an email back in April, an email sent by Al Werner that included the entire board. And after many vicissitudes and an enormous dossier, Grace printed it out. We've got this enormous stack of paper that went back and forth out of that. We have been found to be in violation for over one email. And the corrective action that we have been ordered to take is to make that email public. And we decided that we would do that by reading the email into the record tonight and including it in the minutes of this meeting so that it would be available to the public. So I have that here. And to give the document that we are ordered to make public is labeled Exhibit 11 in the complainant's documents. And the offending email is a response to this email, which was written on Thursday, April 22nd at 9:19 in the morning. Dear Mr. Werner and Shutesbury BOH, too many of our neighbors can't drink their well water because it makes them sick. The evidence strongly suggests our town center aquifer is dangerously contaminated. Comprehensive testing of Amherst middle and high school drinking water proves our children are exposed to dangerous levels of lead, a dangerous neurotoxin, in school drinking water each and every school day. What are you and the BOH doing about each of these individual public health emergencies? As a former BOH member in the 80s, I've never been able to unburden myself of our BOH duty, quote, to raise the standard of public health protection to the highest degree, end quote, paraphrasing Ronald Shattuck, who I don't know who it is. Mr. Werner, your email is hurtful, unprofessional, hostile, and defamatory. Your attempt to silence me is unacceptable. Your conduct needlessly incurs liability for our town. I therefore respectfully request an immediate apology from you, Mr. Werner. BOH members and town administrator, please consider this email a formal complaint against Mr. Werner and let me know how to proceed. Okay, that is, yes.
For the record, who is that email from?
That email is from Michael Hutstein.
Thank you.
And Al Werner's response to this email is the offending thing that we are required to correct. So on later the same morning, Thursday, April 22nd at 11:51 a.m., Al Werner wrote, "Dear Mr. Hutstein, I don't agree with your assessment of the town's water supply, nor do I agree with your assessment of Shutesbury's Board of Health. The BOH works hard, putting in lots of hours for the benefit of the town residents, and I am appalled that you have the audacity to suggest otherwise. Shame on you. Your comments directed at the BOH and the hardworking individuals you disparaged deserve an apology. It is your hurtful, hostile, and defamatory attacks that require an apology. Your attempts to bully and demean this incredibly qualified town board is both inappropriate and unacceptable. Therefore, Michael, I respectfully request that you apologize to the board and the individuals that you have been harassing and that you do so immediately. Town administrator, I would like to raise a formal complaint against Mr. Hutstein for his ongoing and unfounded harassment of the BOH. His contributions to the town have been nothing short of demeaning and unproductive. Respectfully submitted, Al Werner." So to be on the record about this, the part of this email that is in violation of the open meeting law is the very first sentence. I don't agree with your assessment of the town's water supply, nor do I agree with your assessment of Shutesbury's Board of Health. And it has been, let's see, it has been found that both the town's water supply and the overall functioning of the board are matters within the board's jurisdiction. And therefore, this discussion of it was considered a violation of the open meeting law. Somehow, I can't imagine that this is the sort of thing that the legislature had in mind when they adopted the open meeting law, but there it is. So having read this, we will add it to the minutes and then we will be done with this. With your agreement, I think we should put the determination letter on our website. Not the whole dossier, which is, onerous, but just the determination letter. Does anybody have any objection to our doing that?
None.
None.
I think the only thing I would add is that we might consider including with the determination letter Exhibit 11, because we were required to make that available publicly.
I think that's a good idea.
Mm-hmm.
That makes a lot of sense, so that anybody who reads it will say, well, I wonder what that was. And then they wouldn't have to go and look at in the minutes or whatever.
Mm-hmm. Good
idea. Okay. All right. So let us put that behind us. So moving on, we've been given a new email address for Arlene to use. in her professional duties. It is publichealth@shutesbury.org.
Mhm.
And Arlene, I'm thinking that maybe for the next couple of weeks, we'll keep you on the Board of Health email that I use,
Yeah, and
just so we can make the thing.
I will make my usual effort to check it periodically, but don't hesitate to forward along to me anything that, the way that you do, anything that you think I should be addressing. Okay. But
Okay.
I do try to check that once a day anyway.
Mhm.
But shoot things over to me. But any further communications that I send out, I will be doing from that email address. And I had to create a password for it today,
Mhm.
which, if it is needed by anybody else, I can convey that.
Okay. Okay. But in the meantime, you can keep it confidential. And
Sure.
I will, well, there's two ways we could do. I could either change the password on the Board of Health immediately and just forward any of these Maven related things to public health, or we could wait and you could phase it in. It's kind of up to you.
It doesn't really matter. Oh, I see. In other words, ultimately, you would like me off of the Board of Health.
Yeah,
yeah.
because kind of the whole point here is
Got
to
it.
avoid this sort of situation we just had,
Sure.
where if we have something going to or from the Board of Health, it's not
Sure.
available to the whole board.
Okay. Yeah. If you're willing to forward a lot, because various people I have communicated with have that email address as the point of contact for me now. So
Right.
yeah, if you're willing, then I'm okay with that. If you want to.
Yeah, I
that
check it
immediately.
several times a day, so
Okay.
it'll be easy for
Yeah,
me
yeah.
to just forward it to you. So I'll
Sure.
change the password and then
Okay.
it'll just be kind of a clean.
And what
Clean
I will
thing.
do is in Maven, I will change the address in our communications section in Maven so
Okay.
that Maven communications come to that address and not to the other.
Perfect.
Okay.
Great.
Okay.
Okay. Very good. So I talked with Marianne Antonellis at the library earlier this week, and she said she actually may be able to get some of those UMass test kits. She tried a couple of times and people said no, but she found another contact, and apparently she thinks that we are going to be able to get some, and somebody will have to go get them. I said it could be either her or maybe one of us could pop in and get them. And keep them at the library, and then they would be dropped off either at UMass or at one of the drop-off sites in Amherst. Which I think there's one at Bangs and maybe one at Jones. I'm not sure.
I
But we
think
could
Jones
have
is a pickup, is a place
But
to
not a
pick
drop-off?
up the kits, but I do not think, I might be wrong, but I don't think the Jones is a drop-off place. You wouldn't want library personnel handling specimens.
Right.
And so unless there's a courier who comes sweeping through from
Yeah.
UMass, I have a feeling it is I'll look into that for one of us.
Okay.
The one
Well,
in
I'm sure.
the one in Bang Center is just like a mailbox. It's just
Right.
you throw it in a slot and
Mhm.
no one handles anything other than the courier.
So a courier swings by, so maybe a courier swings by the Jones too. So,
I think it is a drop off. Yeah.
but Spear Library would not. I mean, they would not send a courier
No,
up to shoot.
no, they would have to deliver it to one of those.
People would
places.
have to drop it off in Amherst.
Right.
Yeah,
Right. The person taking the test or their family would have to do it.
right.
So Noreen, there was some talk about getting some of these rapid self-testing kits.
Yes, I don't have the information yet. This information came up at the MAFCO meeting on Monday. There are certain towns in Franklin County. Anyone can Google it and find out what towns those are. Shutesbury is not one of them. But there is some discussion. I haven't yet, but I may get some information from Carolyn Shore's Nest. Their health agents seem to know how to get a hold of them. So I don't know if Charlie or, If anyone
Well-
here knows how to get a hold of him. And also we're going to discuss it at the round table Monday,
Right.
which is all well and good, except that it seems to me that if we're going to get these rapid tests and try and distribute them to persons who don't have the means to go and purchase them, it should be done quickly. We need to get them out for the holidays for people who might be needing them, for family coming to visit or traveling or those kinds of things. So the time frame is a bit short.
Right. I was at the district meeting today, and one of the things shown on the budget was the grant budget. Remember, we got a big grant
Yeah,
from the state, and only about half of that grant has been spent.
Right.
So there's in the neighborhood of $25,000 out there, a third of which is legitimately available for us. So when we could buy a case of them if we know how to get them.
What I did forward to you just before this meeting, Kat, was
I may not have seen it.
no, I'm sure you didn't, but it's an email from the bids person, Andrea Woods at FERCog, which had some links and talked about how to go about purchasing them. And I don't know if that's the easiest way. Carolyn seemed to intimate that they should be free. They might be free. Now, maybe Garrett knows more about this from his contacts, and that we shouldn't have to purchase them, because you remember the rigmarole we went through last year trying to purchase things, Kat, or 2 years ago, that is.
Yeah.
I think what I'm confused about is what test kits we're talking about. So
The rapid test kits. I think we were previously talking about the RPC test, correct? And now we're talking about the rapid COVID tests
these
that are
the
being distributed to
in-home.
towns
In-
in-home.
Okay.
Yes, targeted. The intent was to target them to individuals who wouldn't have access to test kits otherwise.
And I think it's important to point out that these test kits that may be made available to communities are different from what is picked up at the UMass pickup
Yes.
centers and drop
Right.
off.
Yeah. I
Those,
think
Yes.
we all understand that.
those are PCR
Yes.
tests that take a couple of days
PCR, yeah.
results to be known, and the ones that are being distributed to community on a community level are the rapid antigen tests, the ones that you can buy over the counter.
Right.
Yes, so
Right.
I think
If you can get it.
I think currently it's 102 communities across the Commonwealth who are eligible to receive them. And that the long-term goal is that this will be part of a state procurement process that local communities can then opt into. So they can buy at this state procurement level
Right.
a number of tests and distribute them. So the initial distribution of tests is based on census data for the 102 communities and the initial distribution. And then the long-term prospect is that all jurisdictions will have the eligibility to access the test through state purchasing.
Yes,
Right.
and
We have Go
I'm
ahead.
sorry, I think that email I forwarded to you had those links and had that description of how you go about it, Kat.
Possibly one of them does. I was just going to read this a line or two from Phoebe that said, any town not part of the distribution will be able to buy from a state bid through combis, though this will not be available immediately. And FERCog is going to send out an email, she says, this week.
Which I think is that more detailed one that came later, Kat. So I sent you 2 emails, and I think she did forward that one as well, that has some links in it, and does refer to their bids person, Andrea Woods at FERCog.
Right. It says in that email, towns should prepare themselves with a combis account if they want to purchase directly from the statewide bid. So we should make sure that Becky has that and that she's got such an account.
I think Becky was on that email. I think I did see her name on that,
Oh,
Kat, but
okay.
but I just looked at it quickly before our meeting myself. I didn't, I was late getting home, and
And I'd be
anyway, I'm pretty sure she's on it.
surprised the town's not in that.
Right,
system.
yeah, right.
Yeah, right. She does say that presumably everybody is in it, but we should just make sure.
Right.
Okay. And, oh, so this is probably not going to work out very well for this. It's not really clear what he means here, but as far as home test kits, he says, I would say yes. But he said, this grant, as I understand it, ends December 30th, but we have the funds, so maybe not. That said, get an invoice before the 30th. Well, I don't know if that can happen. That's Charlie's response when I said, could we spend the.
Right,
Yeah,
and then
we're not
once we get some, we should probably have a discussion and try and think about the best way to distribute them. Because they are supposed to be targeted for people who can't necessarily afford them.
Right, but if we buy them, they're not targeted for anybody.
Oh,
They're
well, I guess that's
ours.
true. Yeah, I guess that's
And
true.
I think that they should be pretty much like the other kits. If people wanna test, they should
Yeah.
just be able to pick them up and
Yeah,
and do
True. Good point.
that. Right, because I mean, all testing is good,
Absolutely.
right?
And I think maybe while we're on this topic, I got a letter from a group that I'm going to be spending Christmas Day with, and I think they followed CDC recommendations, and they're asking everybody to take a rapid test before we go to gather on Christmas Day. So all that, I'm saying, Kat, because it may not hurt. Again, I know I'm always advocating for messages to people to remind folks again, what steps they need to take to be safe during the holidays, and that, using these rapid tests, is one step that they might take to protect themselves and other family members.
Absolutely, I'm totally on board with that, and I would like to get such a message out tomorrow. I've been holding it up a little bit because Arlene and I have been talking about what kind of reporting out we want to do to the town, and I'm hoping that Arlene will have some things to say about that.
Well,
Can I just say one thing? I
nothing
can
to
forward
look
this message I got from my group that I forget what the source was, but it was a good one and it had steps,
Great.
so it might be helpful in trying to
Yeah.
craft that. I'll
Yeah.
find
Yes,
it and forward it to
Let
you.
me have it.
Yes.
You wanted to, Arlene?
Yes, please.
Okay.
And you can send it to publichealth@shutesbury.org.
Mhm.
And I applaud and support the idea of messaging that encourages the layering of protection, many
Yes.
different layers of protection.
Mhm.
I do have a concern when we make available the over-the-counter test, the self-done test, since there is no record of the results,
Right.
that if there
Right.
could be at all points encouragement to people that if they get a positive, that they get word to us.
Yeah.
That, and their primary healthcare provider, if they have one, that
Right.
they tested positive, that they not sit with that information.
Yeah, totally agree.
Right.
And actually, what DPH recommends is that if a home test is positive, the person should be urged to get a follow-up PCR to confirm.
Yeah.
Right.
And to notify all their close contacts.
Right.
And to self-isolate.
Right. Okay, well, I will start putting something together tonight or tomorrow morning that we can send out tomorrow. But Arlene, I would like
Okay.
you to vet it for
Yes,
me. and
I've
help
thought a
with
little
that.
bit more about the messaging, Kat, and to try to create a dashboard like Amherst, it doesn't work so well because of our small population.
Right.
Like Amherst puts up their number of known active cases, and then they put up this figure of the average daily rate per 100,000
Yeah, right.
population.
Right. That
Well,
wouldn't be very helpful
when you
here.
do the math, we have one case. I did the math, and it translates to 58 per average per 100,000 population. If I'm not mistaken.
Right.
So that's not a useful figure.
Totally.
to do that. All right. But I think, and if we go way back to the beginning of the pandemic, what the state was saying was that for towns of a certain small population, that they would just say it was fewer than 5. And then we kind of left that behind, and we've been reporting 0s and 1s and 2s. And so maybe we come up with a dashboard that is updated. I don't know. I can update it daily if you really want me to.
No, weekly. I think weekly is good
Weekly
enough.
about how many known active cases there are as of 8 a.m. on such and such a day, because it changes daily too. You know,
Right.
I'm always getting cat word of, well, I've got 1 case in isolation, but they're leaving isolation at the end of the day today, you know, and,
Right.
and I don't know what day you're sending the message out. So I want it to be current. And so if we put up a dashboard that gets updated weekly and people can go to it when they want to, and it tells them as of 8 a.m. on such and such a day, here's how many active cases there were in Shutesbury, period. That might.
Now, when you say how many active cases there were, does that mean how many active cases there have been over the whole time span?
Oh, no,
Or
well, I
just
could do that.
were-
I could do that too. And I did that today. And the figure is 59. Since the beginning of the pandemic, we've had
Okay.
59 cases in Shutesbury. But both of those figures could be done pretty easily. I can say how many are actively in isolation as of a certain hour on a certain day, and how many cases have we had since the beginning of the pandemic in Shutesbury. If we think that second figure is useful, is that useful for more than just a curiosity?
Well, I'd like to interject something here, because what I use, and I don't know how appropriate it is or not, and maybe we can have a toggle cat that looks at other towns, but I sometimes go through the state report and look at what the case numbers in other towns and use that information perhaps to make a decision about where I might want to go grocery shopping or not that week. And so I think that kind of information might be more helpful than knowing what's going on in town. So I think we can create a toggle that takes us to the town by town look, but I don't know if
do you mean a link or a?
Yeah, I mean a link.
Okay,
Yes,
yeah,
yes. Yeah.
Yeah, well, I mean, we could put in links to what Amherst, Hadley, Greenfield.
Yeah, and perhaps Athol. That's something that's coming to mind.
Right.
A lot of people go to Market Basket, for example, and I know there's a big peak out that way.
Okay.
Well, Arlene, in response to your question, my opinion is that having the cumulative numbers is certainly of interest to pandemic historians, but I'm not sure that it's particularly useful for people who want to know the status.
Yes, I don't think it serves to guide our behavior.
Right.
Well, there was another number we were talking about, Arlene, and that was like the number of cases over the past 2 weeks or something like
Yes,
that.
that was that average daily rate per 100,000 population.
Right, that's the rolling average.
Yes, and that's not, I don't think that's useful data for a town our size. Because
would it be useful to give it in actual cases? Because here's what's happening. People go in and out of isolation and quarantine, and it never gets reported out, because by the time I hear about it, they're not in isolation anymore. They're not in quarantine, and or I'll wait for more information from you, and then kind of.
Okay, so the actual numbers of how many cases in the 14-day period from point A to point B.
Yeah.
Here's how many we had. Something like that.
Yeah,
okay.
I think that would be useful, and that would at least get the information out there, because saying how many are isolating or quarantining now is not working well, because we're not getting not everything is getting reported.
Right. Yeah, if a person waits till day 8 of their symptoms to be tested, and they don't hear the result till day 9 of their symptoms, then by the time I'm even talking with them, they've only got another day of isolation to go. And that,
Right, and then by the
doesn't get
time I
reported
find
back.
out about it, it's over, and so
Mhm.
nobody knows
Right.
that we had that case.
it's true. That happens.
So,
It has
yeah,
happened very
it's,
recently.
yeah, more often than not, it seems like, and Becky pointed out that people are getting a false sense of security about how
Mhm.
very, very safe it is in Shutesbury because the Board of Health isn't telling them that there are cases.
I think that's
Oh,
true, and I think
interesting.
that's why it's helpful to know what's going on in Greenfield, Amherst, Northampton, for example, because you might be making a decision if you want to go to, you know, a concert or something more
Mhm.
public.
Okay.
That
Right.
all the venues are still open now.
So on what day of the week would you, Kat, like to hear from me some numbers
Is
on a weekly
there
basis?
is there a day of the week that makes sense in terms of how you get informed?
I don't think so.
So I would think that either the beginning of the week or the end of the week would be sensible.
Let me-
But I'm not
I'll-
sure which one.
I'll do it. I'll propose that I do it on a Monday.
Okay,
And that I will include data that covers the 2-week period ending the day before, the Sunday.
through the
okay?
Sunday, okay. Yeah. Okay.
And I'll
Okay,
include current known cases, but also number of cases for a 2-week period ending on that Sunday. Okay? Does
Yeah.
that make sense?
yeah, I think it does. I think it does. And
And
what, oh, go ahead, Lynn.
no, I was just gonna say, and Noreen, that might influence your shopping junket decisions, but all the more perversely, it might, if you decide you want to go to jail, don't come to the jail in Northampton. Did you see, did you see the
Thanks, Wim.
paper? Uh-huh.
Right,
Wha-
so be careful where you get arrested.
Right, exactly. Okay. Well, that's my point, though. There may be a lot of decisions you're making that might impact
Exactly.
yeah. Why, Wim, are you going to arrest me for walking across your property again? Because I've been out there doing
No,
that, just so you know.
no, I was
Okay.
just, I'm the medical person at the jail in Northampton.
Right. Yeah.
So
I figured
it's,
as much.
they have a little bit of an issue there right now.
Yeah. Well, I was just going to say, I don't know how much people are familiar with data, but Monday at the MAFCO meeting, it was reported there were 7 cases at Bay State Franklin. And interestingly enough, at least for me anyway, a 4th of them were among individuals who were vaccinated. So, and they didn't, I asked if they had any data on the age range or anything more, and they didn't.
As of today, there are 13 in the jail and 2 are vaccinated.
Huh. So a little lower,
Right.
yeah, percent of the vaccinated. Yeah, which made me wonder, maybe it was age related or, yeah, something
Or
else.
underlying
Steve?
conditions.
Underlying conditions, exactly. Yeah.
Right. So what I'll plan to do is send out a message tomorrow saying, we're going to change the way we inform you, and it's going to be on the website, and here's the link, and just check it every Monday. Right? If you're
Okay.
interested in knowing, check in every Monday. If we have anything else to tell you, we will. But otherwise, I'm not going to be spoon feeding them the information.
Right. No.
Okay.
Good.
And they can go to links other places for COG and,
Yeah, I'll put,
DPH.
I'll put the links up there
Yeah.
and on the website.
And then that, I like it because it makes it accessible to everyone, not just the people who get the Board of Health, who've registered to receive the Board of Health emails,
Right. The people on town announce.
Right.
Yep.
Yeah. Yeah, they might not know it's there, but they can certainly
Right.
go there.
Do others have a sense of how available the in-home tests are? Are they easy to get at this point?
I went to CVS today thinking better get my test this week because next week, people might be thinking, oh, I got to get my test if I want to go to visit whomever. And they had a few and they were all behind the counter. So they were all kind of, you had to ask for them.
And were they
So-
limiting you to one box?
2 boxes.
2 boxes, okay.
Mhm.
And how many in a box?
2 per box.
2 per box.
Yeah, the instructions in the kit are assuming that you're going to test yourself and then you're going to test yourself again 36 hours later.
Mm.
And not everybody does that. People treat it as 2 separate tests often, I think. But that's the intent of the test, is that you have a higher confidence level, obviously, in 2 tests rather than 1, and having 1 repeated 36 hours after the first is ideal.
Okay, that's good to know.
So if
that's
you
why
wanted
they-
to do something on Christmas Day, you would, to do it totally properly, do 1 test, a day and a half earlier, or whatever that would be, and then the other test on Christmas morning.
Yeah, so that's the ideal, just with a confidence level reached with 2 negatives. The desirable confidence level is reached when you have those 2 tests done 36 hours apart from one another.
Good to
But
know.
lots and lots of people just use it as a box that has 2
And
tests.
yeah, right.
Yeah.
And for an instant one-time result.
Right.
Right.
So how much does one of these boxes cost, Noreen?
About $25.
Okay,
So they're not cheap.
no. Okay, well, it looks like it's gonna be a big message going out tomorrow, with all kinds of stuff in it, but.
So I will
We'll get
get,
to that.
even though it's not a Monday, do you want me to get you current figures for tomorrow, Kat? Or do you want to
Yeah,
just do that
that's
on
a good
Monday?
idea. That's a good idea. And we'll give them that and say, okay, from now on, you can get
It's
this
gonna be weekly on Monday.
updated on Mondays
Okay,
on the website.
on the website. Okay,
And you can also look at these links, blah, blah, blah.
okay.
Okay, that's great. Okay. Noreen, have you seen that survey? That
Oh,
FERCog survey?
yeah, I meant to take that survey. I started to take it and then something else came up and I didn't take it. I have seen it. I do have it. I have not taken it.
Okay, well, if you would take it for Shutesbury,
Yeah, okay.
that would be good, because, I started taking it and most of the things I just had no idea,
Okay.
So it didn't seem like my responses were going to be helpful to anybody.
Okay. I will, I'll Google that again and find it and do that tomorrow. I have some free time
Oh,
tomorrow.
I can probably forward it to you, so you'll be fresh in
Okay.
your inbox.
Okay, that's good. I have another update and I don't know if anyone's interested or not, but has anyone been using the Vax bus in town? Do you know, Arlene? Has
The what in town?
the Vax bus, has it come to the school for us, for Shutesbury?
I do not know numbers of people who've been showing up at the bus.
No, but I just wondered if we've even used it in town, because I just wanted to let people know there is a calendar of the Vax bus that you can look up on FERCog, so you know where it's going, what towns it's going to. And there was some confusion at MAPCO because the Bay State Vax bus is going to be discontinued on December 31st, but that's not the Vax bus that's going to the schools. So I
Right,
just wanted to clarify that.
The school publicizes that in the newsletter that goes out to all school families. Every Friday, it has had that schedule included.
Okay, good, good.
And
ever
it's
since
on
it
our
became
website too.
available,
It's
and it's
on-
on our
it's on-
website.
Yeah.
But I
Okay.
don't know the numbers of people who've availed themselves of it.
Okay.
Right.
Yeah, I just didn't want anybody to be confused because there was some word that this other bus is being
Mhm.
discontinued, so.
Yeah, there's still, there's still 5 dates on the Franklin County schedule. So, well, I'll remind about that too tomorrow.
Yeah, that'd be good.
Okay. Okay, are there more things for us to update or discuss? Oh, well, I have something, but Noreen, do you have more?
Well, yeah, just a quick one, and I don't have a date yet, but the REPC, which for you, Wim, means the Regional Emergency Planning Committee, out of FERCog again, and what they do is they plan for if there's any hazardous waste kinds of emergencies. Anyway, they're having a meeting in January. I don't have the date, but they're going to have some PFAS training if anyone wants to attend that. And I will get out more information as soon as I get it.
By training, you mean just informational training?
Yeah,
Not
sort
training
of
to
similar.
do something.
No, sort of like the training that we had when we talked to, UMass and so forth.
Mhm.
When we knew we had some problem areas in town.
Right.
So just to keep, and all Board of Health members will be invited to attend. There may be other towns where people haven't had an opportunity yet to get a little, educational overview of what to
Very good.
consider.
Okay. Well, yeah, I wanted to tell you a little bit about the district meeting that I attended today. We voted to we voted to the 2.5% increase. That's pretty much standard. And we actually, they have been under budget for several years, and they have a huge sort of contingency fund in case one of their towns can't for some reason can't pay their share, and they need to cover it. And they also have a little surplus in the sort of free cash account, and so they're going to use that to get started increasing what's her name, Claudia's salary, which has been pretty stagnant. And by the way, Claudia is making great strides getting up to speed on the septic system part of the job. And it's not easy because training is hard to come by. And also, we are trying to work out a way for Claudia to get health benefits because she doesn't have any health insurance. She's paying everything out of pocket. And so,
Ironic.
yeah, huh? And so Charlie asked Leo Parent to see if she could get put on as a sort of employee of Irving, and then we'd work out, sharing the cost of it among the 3 towns of the district. So that's kind of a future increase that shouldn't be that bad. And at least for a couple of years, we won't hardly notice it because they've got this surplus that they can use up. The other thing we were talking about was that there's kind of a crisis here in that the health agents and other professionals sort of on the ground public health, who be the people who do the inspections and witness the perk tests and all that stuff. All those people are retiring, and there's not another generation of younger people coming up to replace them. Claudia, to some extent, is one such person, but there aren't very many, and there's almost no training out there for people actually to get into this profession. So we got to talking about in fact, Charlie has a whole long memo that he wrote at some point about a plan for workforce development, including sketching out what would be a 2-year degree in health agenting at a community college level. But what it would take would be, well, one of the things that it would take would be to get the legislature to invest in it. So if anybody has, and we kind of don't know where to start, I'm going to start just with some writing that we can use to kind of introduce ourselves to whoever is our target. But if you have any ideas about how to approach this and how to get the right people on board and who the right people might be, let me know.
Is this a problem in larger jurisdictions as well, Kat?
It's a problem throughout Massachusetts and probably throughout New England, if not the whole country. I don't know about the rest of it, but it's all over Massachusetts.
Okay, thanks.
But there is a huge turnover in the 60 towns I work with. Just within this past quarter, we've seen at least a dozen people go.
Yeah, they're really dropping out of it. And there's just nobody replacing them.
And some of it is retirement, but a lot of it is burnout, to be frank.
I'm not surprised because there are so few of them. They're really overworked. Yeah, so if you have ideas, in fact, when I'm working on this document, if I can copy you in, Garrett, for your input, that would probably be really helpful.
Sure.
Can you make a living at this? Do you know, Garrett or Kat? Can you make a living at the?
Yeah. I mean, it's a job. It's especially if, like, at our district, a person gets a salary for doing it. Other people work per diem or per hour or whatever, but they get paid reasonably well. I mean, it's not a menial job. It's skilled labor. Claudia took I think it was the septic system inspection test, and she passed it, but it's very difficult. You have to get a 75 to pass, and something like 40% of the people who take it fail. So I don't know if everybody gets, if this is typical of the wage scale. Charlie said that he was giving an example that out in the Berkshire Public Health Group, I forget what they're called, you can hire a person from them to do whatever job you need to be done at $75 an hour. But the person who does the work gets paid something like $32 an hour. Still, $32 an hour is not, an unreasonable wage. But obviously, there's a little too much being spent on administration. So something to think about. If you have any thoughts, please communicate.
Are they reimbursed for transportation when they have to drive out to wherever to do an inspection or witnessing a perk test? And do they get paid mileage?
I don't know how it would work out in the Berkshires. I mean, with our district, they have that built into the budget. They have transportation and gas and stuff that's built in. If they're working individually, I'm not sure how it works. One thing that I asked specifically when there was a reporter there who was basically just kind of, I don't think he's going to report on the meeting particularly. He just kind of wanted to find out about it. A real young guy, obviously new to the Greenfield Recorder. And so things were being explained to him. And one thing Charlie and Claudia were saying was, the towns who are in our district, at least, and other districts, if they're, where they have them, we're getting a really good deal for the money. And I said, was that true with respect to, for example, Phoebe's group, where you can hire her, join that. And they said, yes, that financially it's better. We're getting better service. We're not in competition with others, and we're not paying so much. So that's good to know. So, anything else?
Not from me.
Sounds like we're done.
Oh.
We have a motion to adjourn.
So moved.
Second,
All in favor?
yes.
Yes, please. So Garrett, you can go ahead and turn off the recording.